What is uterine artery embolization and when is it needed?
Uterine artery embolization is a very minimally invasive technique in which we use a small pinhole size catheter and sheath, and we go selectively into the artery feeding the uterus and causing the abnormal fibroid, AVM or other pathology, and we stop the blood flow in the artery. And it can be needed in many cases, like a symptomatic fibroid which has not responded to the conventional medical management. It can be used for uterine AVM, which can be congenital, or more commonly they are acquired. It can be used even for adenomyosis, for PPH as an emergency procedure, or it can also be used for abnormal placentations.
Why is uterine artery embolization better from the conventional modality of managing fibroids?
Conventionally, especially in India, what we are having is hysterectomy for symptomatic fibroids, and that is a major abdominal surgery. Even if it is done using laparoscopy, it has a long recovery period. And as compared to hysterectomies and even myomectomies, the uterine artery embolization is very less invasive. No scar is given, no sutures are needed, and it requires stay for only overnight stay is needed, and there is very minimal blood loss. The patient can resume their day-to-day activities far quickly than a major surgical procedure.
What is your clinical experience on the results and the present literature evidence of this procedure?
My clinical experience with uterine artery embolization has been very good. It provides good symptomatic control in above 90% of the patients with uterine fibroid and around 98-99% of patients with AVMs and secondary PPH. And now uterine artery embolization is a well-established procedure. We have literature dating back 20-25 years, and there have been many randomized controlled trials also which have compared it with hysterectomies, also with myomectomies and conventional medical management, and they have shown significant good outcomes with shorter hospital stays and less morbidity and less major complications.
What is the message you want to give to the general physicians about managing the patients in their OPD post this procedure has been done by an interventional radiologist?
Post the procedure has been done, we recall the patient at 1 week and maybe after, for a second visit during 1 to 3 months. Rest, the patient can very easily be managed on OPD basis. Most of the patient only require oral NSAIDs for post-procedure pain management, and they can comfortably manage. They can follow up the fibroid and the reduction in size using ultrasound, which is easily available. Few of the patients might require MRI.
What is radial approach and how is this beneficial for the patient when we look it in comparison to the conventional hysterectomy?
Radial approach is even less invasive than the conventional femoral approach which we use for most of the embolization procedure. In this, we place a very small sheath in the radial artery, and since the sheath is placed in the radial artery, not in groin in the femoral artery, the patient can be made ambulatory. The patient can walk around immediately after the procedure. No bed rest is suggested. So this makes the procedure even less invasive and very comfortable for the patient.